Every year, millions of people around the world unite to shine a light on one of the most pressing health challenges of our time, cancer. Today is World Cancer Day. The global movement is dedicated to raising awareness, promoting early detection, and encouraging equal access to quality health care. Breast cancer remains the most commonly diagnosed cancer worldwide, accounting for more than 2 million new cases each year. Joining us in the studio to talk about the World Cancer Day is a breast cancer survivor, Jacob Omonade. It's good to have you on the program this morning.
Thank you very much.
You're welcome.
Thank you.
Now, can you take us back to when you first noticed symptoms when you had breast cancer? What was it like for you when you eventually got diagnosed with breast cancer?
Well, thank you. It wasn't funny. It wasn't easy because, first of all, I never knew that breast cancer can actually affect men too. I never knew about it. So when I noticed the lump 8 years ago, it was a tiny bean-sized lump on my right breast.
Okay.
And when it was there, I actually didn't take it serious because I thought it was just maybe my body reacting to something I ate. So that was it. And after in 2023, I now noticed that the lump had increased a bit in size. So I was just wondering what it was. So I spoke with my kid sister, who happens to be a doctor. I showed her, and she showed like that I should just try to get some testing and all of that. So in 2024, in the morning, I was getting ready for work, and my wife noticed that there was something dark under my breast. So that was when I now had to look closely, and I saw that lump had already increased in size, and it had this dark patches now on my skin where the lump was. So I got really worried, and that was how I started to run a diagnosis test at the National Hospital, Abuja. And on the 7th of September, I was finally diagnosed with breast cancer. So I started treatment at about November. I had chemotherapy. I've actually had 6 cycles of chemotherapy, and I've had a semi-bilateral mastectomy, which is the total removal of my right breast. And the other one, they just remove the tissue so that it doesn't cross this way. So that's how it has been. It's not been easy. It's a whole lot, because for my first round of treatment, I spent over 17 million naira for my treatment, because each of my chemotherapy cycle did cost 2.450, and I had 6 cycles. And in between all of that, there are tests that I do, CT scans and all of that, and that's it. That's how it's been.
Well, like you say, male breast cancer is quite overlooked and rare in most cases. A lot of people don't expect men to have breast cancer.
Yes.
I would like to ask, aside the funding that you mentioned, which is heavy cost that you had to incur, what other challenges do you encounter? And on the other hand, what other advice would you give to men that find themselves in that kind of position, as you both mentally and all round?
Okay. First of all, it's a big one. It's a big one. It's heavy. It's heavy. The truth about it is, the awareness for male breast cancer is very, very poor. It's very, very poor. And after what happened with me, I took it upon myself that I was going to advocate. I was going to shout at the top of my voice. I was going to do everything that is possible. I was at the Medicaid One Walk, One Fight, and which I addressed the crowd, letting them know that male breast cancer is real, And I also have started a project called It All Starts With a Lump. It all starts with a lump. It's my own way of trying to spread the word. Let men know that male breast cancer is actually real. And I actually just did a song. for cancer. I'm going to be at the NEPSIN cancer event at Mona Lisa Park, and I'm going to be presenting the song there. You know, it's actually a song that's, you know, that talks about cancer and all of the weight, you know, that it drops on us. I'm talking about challenges. I would say, for me, I'm going to speak about myself now. Part of the challenges that I have faced so far, I would say, okay, I am still undergoing treatment because after the first course of treatment, my oncologist said that after the last CT scan I did, she said that the cancer has spread to my lungs and my liver. So I have to go back to systemic treatment again, which is going back to chemotherapy again. And I was supposed to start since September last year, July, September last year, but I have not been able to start because of the funding. And also,
unfortunately, Mr. Monade, we've run out of time, but with the little you've contributed, we must say thank you so much for your contribution, and we definitely look forward to seeing you champion, you know, the cause of cancer as we move on. Thank you so much for your time.
Thank you very much.
Thank you.
Thank you.